This is Living Healthy with the Woman in You, the show with the information on health that you need to know from people you can trust.
Hi, welcome to Living Healthy. I'm your host, Sheryl Turgeon. In most of today's pharmacies, you can walk in and get any drug ready-made to help you with virtually any ailment. But is that the most effective method for treatment? People come in all different shapes and sizes and react differently to anything we put in our bodies. What if we could get a prescription that was tailor-made for us? Today we'll be talking to registered pharmacist Stephen Bernardi, Vice President of Johnson Compounding and Wellness Center in Wareham, Massachusetts, the first sterile PCAB accredited pharmacy in Massachusetts. We will discuss the benefits of nutritional supplements, hormone replacement, and other pharmaceuticals. Welcome, Stephen.
Oh, thank you so much. Thanks for having me.
Oh, we're so happy to have you with us. I think this is a fascinating subject.
Yeah, I think it is too.
And you know, I think that many people probably aren't aware of what compounding is and what it entails. Could you describe that for us?
Sure. Well, you know, before the advent of modern medicine, compounding was all that ever existed in pharmacy. And so it's really taking a doctor's order made specifically for a patient and putting the ingredients together in the proper dosage form and strength that the doctor requires in order for the patient to get the best benefit from it. So, you know, in the 30s and 40s, once different drugs started coming out, they got away from it. So by the time, you know, I went to pharmacy school in the 70s, and by that time, there was hardly any compounding going on. But in the last 20 or 30 years, there's been a real resurgence because the one-size-fits-all doesn't really work for, you know, you can't give the same medication to a 5-year-old child as you can a 55-year-old male or female, as the same as a 75-year-old person. So there's all different reasons why we need this type of service.
I'm sure there are. Why is it that we got away from it and that it's rarely used today?
Well, I don't think it's rarely used today, but it's definitely, you know, the smallest percentage out there. But I think we got away from it because, you know, the big drug companies sort of control the market, and so as they, you know, they have stockholders to report to, and they're not going to tout the benefits of compounding. They're just going to keep coming out with new things to try to keep their market share and keep their stockholders happy, and not necessarily in the best interest of the patient. But I think a lot of doctors have discovered that it's not what's best for their patient, and between the amount of side effects, the problem with people taking medication, in different people that can't swallow, people that are allergic to certain fillers and dyes that come in these things, that they just, you know, our job is sort of to educate people. You do have a choice, because for too long people didn't think they had any choice.
I'm sure they didn't. And what are some of the benefits of compounding?
Well, I think that the biggest benefit is that you can get any strength and any drug in any dosage form that you want. I think it's, with respect to something like hormone replacement, you can combine two or three, or what would be 2, 3, or 4 different prescriptions into one cream or capsule, and so there's better compliance, meaning the person's going to follow the directions. It's a lot easier to use something once a day, one of something once a day, than it is to use 4 different things separately, and maybe have to do that 2 or 3 times a day as well. So there's a compliance issue. There's a cost benefit. There's a savings when we can combine things into one dosage form. There's lots of pediatric problems out there today that the only drugs that are available for the kids is the same drugs that are available for adults, but because there isn't a big enough market, they're not being made in children's dosage forms, so we are able to take the adult dosage form and convert it to a form that the child can use.
And I would imagine with something like hormone therapy that if you're tested for what levels you have, you can be more accurate, can't you?
Oh, sure. I mean, again, the commercial, not to beat up on the manufacturers, because that's all, I mean, that's what most people know, but there really are a one-size-fits-all. We're all, you know, in pharmacy school we learned that drugs are dosed milligram per kilogram, meaning a certain amount, we have different body types. We have people that are very thin, we have so-called normal, average, we have people that are very heavy. A lot of things change with age as well. Senior citizens have much less of an ability to metabolize drugs, so they really need a reduced dose. And again, that's not always, sometimes, yeah, you can get a tablet and break it in half, but it's not a real accurate way to do it, and it's not very often that a dose is going to come that way anyway. So it's kind of like, okay, a new drug comes out and it comes in 5 milligram and 10 milligram and 20 milligram, and you sort of have to fit into that. So it becomes difficult. It's a real challenge, and that's, I think, where you see the side effect profiles increasing. I mean, you watch these commercials on TV for these drugs, and it's like, it can cause explosive diarrhea, and it cause this and that, and heart attacks, and sudden death, and you're looking like, who, if someone joked recently, if a car came out and said it would cause, if a car was advertised on TV and it said, this can cause sudden death, I don't think many people would buy that car, but it seems like we're flocking to the doctors to get these drugs that are very often very dangerous.
I'm wondering if you could give us maybe a few specific conditions that really benefit from compounding that the traditional manner of filling prescriptions wouldn't work as well.
There's a lot of examples, okay? There's people that are allergic, so we make a pediatric liquid for children with ADD. So the commercial product is full of dyes. If you look up ADD, one of the causes of that, or ADHD, as it's more commonly called now, is dye, okay? And specifically, it's this red colored dye that is in the commercial product. So the light bulb goes off and says, well, maybe we could make it without color and without sugar, and maybe it might help the child. You get things like, there was a thyroid shortage in the last couple of years, where you couldn't get, it was pulled off the market, so we started compounding it. And when the commercial manufactured product came back, people didn't want to switch, because when we compound it, we don't put anything extra in there other than the active ingredient and something inert to put it together, whereas the commercial products have a lot of other ingredients. And so that may or may not be a problem for some people. If it's not a problem, there's no sense in doing it. But for a lot of people, they discovered there was a problem. Animal things, making things in a form that an animal can take. We do a lot of veterinary compounding where...
Oh, do you?
Yeah, so dogs and cats and exotic animals and the like. And so there's a lot of human drugs that are used in animals. Again, a lot of times the veterinarians want to dispense these in the office, but they, again, are subject to the same type of thing, where they only have it in 1 or 2 strengths. And, a cat that weighs 2 pounds versus a cat that weighs 20 pounds, you can be sure that they need a different type of medication. We make things for cats for thyroid disorder that you literally rub 1/10 of a cc into the ear, inside the ear, and it gets absorbed through the skin. So there's a lot of reasons when you can't get things, not just in animals, but in humans too, as people near the end of life, hospice type patients, and they can no longer swallow. You can rub things on their skin. When my dad was dying, we did that, and he was unconscious, but we were able to keep him comfortable because he was agitated by rubbing a compounded combination cream on his inner arms. So there's a host of different things. There are drugs for arthritis and anti-inflammatory type drugs that, when you take them orally in a pill, cause a lot of stomach distress, whereas if you make them into a cream and rub them right on the area like your knee, the drug penetrates that area, but it doesn't get absorbed into the regular bloodstream, so it's not causing that GI side effect.
Fantastic. And I know that you also do compounding for supplements. Can you tell me a little bit more about that?
Sure. Well, we found a lot of physicians that we work with were seeing patients who had multiple chemical sensitivities and multiple disease states that needed high doses of supplements. And so they would leave the office and they would have a list of 10 or 12 or 15 different supplements that they were to go out and buy. So besides the fact that it was very expensive to do that, it was also very poor compliance, because even if you did have the money to go out and buy all those things, it was very difficult to remember to take 4 of this pill and 6 of this pill. So we developed a method of getting pharmaceutical grade nutrient supplements, vitamins, minerals, herbs, and combining them into a dosage form that can be taken twice a day, that for the most part we get insurance coverage of, so the people are just paying their copay, and we're able to give them a dose that's in a form that they can take, and it's much more, it just increases the compliance, and see really, really good results with it.
Fantastic. Now, do you put that in a capsule form, or is it more in a powder?
Well, we do it two different ways. We do, for people that are used to doing like a smoothie, we're going to do we recommend the powdered form typically just because it still ends up being 12, 15 capsules a day. I mean, it's not 12 or 15 different ones, but it is still, to get all those ingredients into the right amount that they need, it still does require a fairly large amount of capsules. So we give the person the option. You know, some people just don't want to taste it, so we'll either make a flavored powder that they mix in a smoothie, or if they don't care for that, or they just say, no, there's no way I'm going to use that, then we make it into a capsule form and figure out how many they need to take a day.
And what kind of ingredients would you use for flavoring?
Natural fruit flavors typically. You know, there's mango and peach and stuff like that. All flavoring is dependent on the active ingredients. So people come to us for their child or for their dog or cat or whatever, and say, I need this flavored. And so you have to figure out what flavors you can use, because you can't use, not all flavors go with all drugs or supplements. And so first you have to figure out what the options are, and then you'll give them a choice. Well, I can make it in Tutti Frutti or bubble gum, or, you know, it depends on, you know, for like cats, you're going to do tuna or fish or liver. Humans usually have fruit flavors, but then amongst the children, you know, there's grape and watermelon and bubble gum. It sort of depends on what, you know, the different kids want.
Right.
And do vanilla marshmallow and chocolate and...
Do you?
Yeah, but those are things that you want to do. I mean, but, you know, you want to use as little as possible, because you don't want to dilute the drug. So as little as possible flavoring you can use. Like newborns, there's a lot of newborns that come out of the hospital and they have all sorts of food allergies, and they end up putting them on drugs for their stomach. And so the babies don't get any flavoring, because they don't develop taste buds till about 3 or 6 months. So it's silly to put a flavor in there.
Oh, really? And is that a fairly new phenomenon that babies are...
We've seen it the last 4 or 5 years. I'll tell you, it's really disturbing, because it's the little purple pill that you see advertised on TV put into a children's form, and I don't, you know, I think it should be used for like any drug, as little as possible for as short a period of time as possible while there's a situation going on. But ultimately, I think you know, especially with babies, you have to address the fact that, you know, there's something going on. Either a lot of them aren't breastfed, so that's part of the issue, or you know, usually it's formula babies, and the formula is wreaking havoc with them.
Exactly.
And so you got to figure out what they can have versus, you know, giving them a drug to suppress the you know, the acid and whatnot. I don't know, it's kind of a...
Right, and I mean, probably probiotics would
probiotics and digestive enzymes, they'd be much better off. But again, that's, you know, we're not doctors.
Right.
And it's not our position. If people ask us, we give advice. Pharmacists, we've always done that. That's part of our job. But we're not prescribing medications, and we're not trying to make people have issues with their doctors either. So we want to try to just support the person as best we can.
Can you tell me, I'm not really familiar with what you would look for in a compounding pharmacy.
Well, I think you would like to see the one that's accredited. There's a big movement on nationally to accredit pharmacies. There's even some insurance companies that are saying they're only going to, if you have insurance, they're only going to allow you to go to an accredited pharmacy. The accreditation process is intense. There are certain standards that are out there. They're called USP 795, which is for non-sterile, and USP 797, which is for sterile. And unlike when I was growing up in the pharmacy and we used to just take the back counter and pour a couple bottles together or mix things on the counter that wasn't really clean necessarily, now we're doing everything in a closed-off room with filtration, with our employees being covered from head to toe. They're gowned up, their feet are covered, they have a mask on and a bonnet and gloves. So those, you sort of want to know what it looks like, I think. I mean, even though that's not practical, I mean, we mail a lot of our packages out as well. you can still go online and check us out and see what our room looks like. You really don't. I know I've gone into places where they say they compound, and I look around and I'm trying to see where are they compounding in this pharmacy, and it's well, they're compounding on the back counter, which really isn't right. You're not really supposed to be doing it that way.
So who do you work with in terms of providers?
Well, there is a certain type of provider, I'd say, that is more in tune with compounding, and I think these are people that have gone to things like ACAM and A4M, more like an integrative type practitioner. I mean, that's probably the main one, because they know that it's just they just don't want to use the commercial products. Just don't fit for most of their patients. For the different types of therapies, when they want to offer the complementary therapies, they're not going to necessarily be able to find that in a commercially available drug. And then you have, like the breastfeeding mothers who come out of the hospital and they need something called APNO, which stands for all-purpose nipple ointment. That's just sort of a commonly known thing. It doesn't mean you have to be an alternative practitioner. And then there's people that come to us that aren't getting satisfaction from whatever it is that they're doing, and they'll say to us, "What can you do?" And we'll tell them, and they'll say, "Well, what do I tell my doctor?" And we'll say, "Well, just tell your doctor to call us, because my doctor," or they'll say, "My doctor doesn't know anything about it." And we'll say, "Well, just have them give us a call and we'll explain it to them." And so we have a percentage that do that type of thing, where they don't necessarily know a lot about it, but they trust us enough because our reputation, we've been around long enough and we've helped enough people that they trust us to do the right thing. So in some respects, we'll have to educate the practitioner as to what they can do. I mean, it's always an eye-opening thing when you can tell someone, "Did you know you could do that?" "Oh, I didn't know you could do that." Right now we're making something called serum eye drops, which is people have their blood taken. We have a phlebotomist that comes in 1 day a week, and she takes their blood, and then we take the blood and we spin it in a centrifuge, and we take the serum portion off of it, and then we mix it with something else and dispense it in a sterile container, so people with severe dry eye and other eye problems can use this. There's nothing else like it, and there's nothing else that they can use. And so there's all sorts of things, but again, it's sort of those things, like that thing came from Mass Eye and Ear, but there's things, all sorts of things like that out there that we do.
That is wonderful.
Yeah, it's fun. It makes it fun practicing pharmacy. I got to tell you, I've been doing it a long time, and it got to the point in my career when it wasn't fun anymore. And now this is really, you get to go to work, you get to use your brain, you're not just a machine. It's very challenging, but it's also very rewarding because you get a lot of positive feedback.
And of course, you're in the Boston area, so you have access to, I would say, cutting edge
without question.
medicine and technology.
Yes.
So
yeah.
That's fantastic.
Yeah, thank you.
I'm wondering if you could tell me about any customers who have had a better result due to using a compounding pharmacy with whatever the condition might be.
Sure. I mean, I think I spoke of it before, like the thyroid is a big one where the commercial product, the commercial thyroid, that's another one where a lot of the strengths have these yellow dyes and purple dyes, and again, it's people with thyroid, it's going to wreak havoc with them. With hormone replacement, they did all these studies to find out that, all these synthetic hormones, they suppressed hot flashes, but they also caused breast cancer, and they also caused uterine fibroids and different things like that, whereas what's called bioidentical, which is sort of a controversial term, but it basically means it's the same as what's in your body. It doesn't, people think it like grows in a plant and we pick the plant and grind it up. It doesn't really work that way. Everything has to be synthesized at some point, but if it's synthesized to match what's in the body, there's a big difference than taking horse urine and taking all the hormones. The horse urine has the 3 major hormones that exist in a female, but it also has 14 other ones that don't exist in a female, and those are the ones that cause the problems. Same thing. As in
Premarin.
Right, exactly, and the same thing with like Provera, which was Premarin and Provera together was called Prempro, and it has something called medroxyprogesterone, which is, again, it's a synthetic form of progesterone, but it's not. It's got something the body doesn't recognize, and that caused all sorts of problems too. So, by using natural progesterone, you're able to avoid those side effects and actually help with all the other side effects that a woman might be experiencing at menopause. And
have you done any studies or followed any of your patients to see, you know, what kinds of outcomes they've had from using compounding medications?
Well, you get feedback in the sense, I mean, we don't do any studies per se, we do follow-up, but you'll get feedback on the thyroid preparations that their levels are better and their, you know, the hair stops falling out and their symptoms are better. Same thing with the hormone type of thing. The hormones, when you use them topically on the skin, they're not they're not detected by a blood test. So a lot of times, you know, we've gotten so technological with things that we say, well, if it doesn't show up in the blood, then it's not working. But the reality is, you have to test in the saliva, because in blood, all you're getting is drugs. The way most drugs work is they go into the blood, and then a small portion is in the blood, and the rest of it's in the tissue, because it's in the tissue where it works. So if you try to take it out of the blood, you're sort of looking in the wrong place, if you would. You need to look in the tissue, and the only way to really get an idea of what's going on in the tissue is from saliva. And plus, with the blood test is real time. It's like what's happening, what's in the blood right now when I'm drawing this blood out of you. It doesn't say what happened to it 2 hours ago when you took it, what happens to it 6 hours later when it's been around for a while. So it's not a real, I mean, it's useful for some things, but I think there's a definite flaw in the science behind it as well. And it's also like, even with nutrient levels and things like, you know, people know sodium, potassium. You do a blood test and say, okay, your potassium's low, we have to give you some. Well, you know, if a normal potassium has a range of 4 to 6 and your potassium is 4.1, they're going to tell you that's normal. But it's really not. I mean, it's borderline low, and it's 1/10 away from being abnormal. So I just think you got to look at people's symptoms. And like our old doctors used to do when they had time to spend an hour with you, talk to the patient, listen to the symptoms. There's a lot of stuff with thyroid where the doctor will say to the patient, no, there's nothing wrong with your thyroid. Well, my hair's falling out and I'm tired all the time and I have dry skin and I'm constipated, and you go on and on. Well, yeah, but your blood test is normal. Like, okay, well, what did we do before we had blood tests? We treated you because you gave me these symptoms, and these symptoms fit a particular condition, and we knew how to treat it. And I think just too often we rely on this fancy technology and don't look at the patient. And that's the person. That's who you're not treating the symptom. You know, you know, Western medicine is really good at diagnosing. Okay, you have this, this, and this, and let me look it up in my book. And okay, this is how we treat it. Well, you know, because the drug company told me this drug works really good for this, versus okay, what's going on with you and what. We were trained as we've gotten into more and more into the complementary field, to always ask why. Why is this happening? Not just settle for an answer. You know, you got, okay, so this is happening, so why? And when did it start happening? And what event in your life, when did it change? And you know, like very often after, you know, you have after childbirth or after a certain event, a traumatic event in someone's life, a head injury, did all of a sudden things start happening. And that's to me is what's not being looked at today, for the most part.
Yeah, rather than fitting someone in a category or a specific range, it's really looking at the individual.
Yeah.
If I want to pursue this method of compounding for a prescription, what would be my first step?
I think you ask your prescriber, your practitioner, what, you know, I'm looking to do this, I really don't want the commercial products. And you know, you want to make sure that there's a benefit, a true benefit, because sometimes people will hear these things and they'll call me up and they'll say, oh, I want to get my Motrin made compound, and I want to get my Lipitor, you know, and I'm like, for what reason? Well, because it sounds like it's a better thing. Well, we, by law, can't just take those drugs to begin with and even do that unless there's a reason. We can't make the same formula as, say, Motrin. We'll make ibuprofen pure without all the different ingredients. I can make a pure ibuprofen, and that's okay, because I'm not. It's really a patent infringement if you just want to try to go out and copy what somebody else does. It has to be something different about it, and so you want there to be a reason for it. You don't want it. It's not just about okay, because I want that. You know, and I don't want to. You know, if it's again the example of when it could go from a $10 or $15 or $20 copay to a $50 copay. I mean, I don't want the person to pay extra. If there's no real need, if they're
Sure.
taking the commercial product and it's not bothering them, then there is no real need. And I'm never going to tell someone, yeah, you should do it just to promote my business. That's not the way I operate.
Right, right. That makes sense.
I talk people out of things all the time.
Do you?
I do. You have to, because you have to be honest and upfront with people. I don't want anyone leaving and talking bad about me because they feel like I did something wrong. I want them to understand what's going on and what the situation is.
And what would you advise people to look for in a compounding pharmacy?
I would go for accreditation. I would try to see what kind of staff they have, try to see what the facility looks like. Ask other people about it. Do you have any experience with them? Ask the doctor. Ask friends if they know. Check them out online, I suppose. Look it up. See what kind of operation it looks like. The best bet I think is calling up and talking to someone and seeing how accessible it is to get to reach somebody.
Yeah. And one last question. I'm
Sure.
just wondering how you got involved in a compounding pharmacy in the first place.
Well, I did it for my whole career, but in a much lesser level. 25 years ago when I first my wife and I bought our pharmacy, I was doing some fertility medications, and fertility patients required progesterone suppositories. And because I didn't really have the ability to do that the right way, I sort of like farmed out that business. But as I saw that demand for it, I joined, I said, I have to do this the right way. So I joined a company called PCCA, which is Pharmaceutical Compounding Centers of America. And they're an organization, an international organization of pharmacists that all they do is support compounding, be it whether they inspect the chemicals that they're using or come up with formulas and the like. So as I saw a need, I said I have to, it's like everything. I always want to do things the right way. So I went and became a member and sort of took it from there. And as I saw things develop, I said I need to learn more and more about this. You sort of become seminar junkies and trade journal
Sure.
junkies, and you just sort of get fed by it. You want to learn, the desire is there to learn.
Well, I can see your passion for it. So, thank you, Stephen. It's really been a pleasure having you on here tonight.
Oh, thank you. I enjoyed it a lot.
Hope you can come back and join us again.
Yeah, I don't see why not.
For more information on Stephen Bernardi, visit www.naturalcompounder.com. You can also contact him at 781-893-3870. And you can find him on Twitter at JCWC. Thank you for joining us today. I'm your host, Sheryl Turgeon. We'll see you next time on Living Healthy.